slowdown in people joining us. I think this is probably it. So we'll make a start. So first thing, just to say to everyone, we're recording the event today, and so hopefully you guys are happy with that. But if anyone is unhappy, let the people who organise this meeting know, and we'll make sure that recording is not shared, or any of your inputs, if you make any, are excluded from the recording. But with that done, I'd just like to introduce myself and the various people we got on the call today and the purpose of why we're here. So my name is Stephen Jivraj. So I am what's called the program lead of our undergraduate course in Population Health Sciences here at UCL. And I'm joined by a colleague who will talk in a moment, Paloma, as well as a couple of our current students, Mona and Warder, and one of our alumni, Jamie, who's also on the call here. But before I let everyone introduce themselves, let me just say that we're here for an hour today, and what we plan to do is start with this welcome. Then we're going to go on to hear from Paloma about what you guys can sort of expect as UCL students in terms of getting involved in active things like student representatives and things like student societies. Then we'll move on and have an open Q&A with the students that you guys can hopefully see on the call, and that'll be a chance for you guys to ask anything you like. It can be as broad as what's university life like, specific in the sense of what's it like to be a student at UCL, or we're more than happy for you to take or pose, and we'll take questions about the specifics of our course in Population Health Sciences. And then we'll end the call today with what will be probably about a 20 to 25 minute lecture, which I'll deliver myself. So let me just start by asking the people that I have here from UCL to introduce themselves. So I'm just going to knock off this share a minute so we can all see each other a bit more clearly. So Jamie, do you want to kick off and introduce yourself for us?
Yeah, by all means, Stephen. Hi, everyone. My name is Jamie. I'm a former alumnus of the BSc in Population Health Sciences with data science. I've since gone on to do a master's in epidemiology at the London School of Hygiene and Tropical Medicine. And late last year, I came back to UCL to start my PhD in epidemiology. I also teach with Stephen on the BSc, specifically with the data science pathway and quantitative research methods. And I also work part-time with a firm called Health Lumen that aims to predict and model the future burden of non-communicable diseases. So.
Great, thank you, Jamie. Mona, would you like to introduce yourself?
Hi, my name is Mona. I'm a third-year student studying the BSc Population Health and Sciences, and I'm currently doing the non-data route. Yeah.
Great, thank you, Mona. And Warder, would you like to introduce yourself?
Hi, everyone. My name is Warder, and I'm a second-year Population Health Science student, also on the main program, and I'm here today to share my experiences of UCL and the course in general.
Great, brilliant. Thanks so much, guys. And Paloma, would you like to introduce yourself and then go on to talk about your involvement with the students?
Sure. Thank you. My name is Paloma Garcia, and I'm the Student Experience Manager at the Faculty of Population Health Sciences, where the Institute of Epidemiology and Healthcare is actually based. And first, I would like to congratulate all of you for receiving an offer to study at UCL. I'm sure that you're all very excited with this opportunity. Some of you may be scared, right? And that's absolutely fine. Most of you will leave home and your friends and family behind to start this new journey and new chapter in your life. And many of you will actually move to a whole new country. So we understand that you are going to go through some challenges. But when you come to UCL, you will find that there are loads of people here who will help you and support you throughout your studies. And this is the message that I want to really give you. When you first arrived, you will be taking part in what we call the Transition Mentor Program. And Warda was one of those leaders, and I'm going to explain to you a little bit what this is about. Throughout this program, each of you will be put in a group that is led by 2 or 3, or by a year 2 or a year 3 student who is also studying in this same program. And as I say, Warda was one of those leads. And this student will work with you from October to December to help you settle in, to answer questions that you may have, to give you tips on how to live cheaper in London, or tips about the program, or tips about UCL, etc. So I really, really recommend that you all take part and take advantage of this program, participate and make the most of it, because it will help you settle and feel at ease a lot quickly. In my role, I also work to ensure that you not only walk away with a degree at the end of your 3rd year, but that you also have opportunities to develop as a person, and that you find in UCL friendly community of students and teachers. We organize lots of social events throughout the year to help build the students' communities, and each program has a budget that it can be used to build these communities and organize events. And you can decide collectively on how you want to spend this money and what events you want to have. UCL also has over 320 different societies and clubs that you can get involved with. So if you like tennis, or you like running, or singing, or dancing, there are clubs for all these activities. Even there is a karaoke society for those who like singing. And we also have our own population health society in our faculty, and this is run by undergraduate students in your program. So we really, really recommend that as soon as you start in UCL, that you join one or more of these clubs and societies. Membership is usually very, very cheap, about £3 or £5 for the entire year. This really gives you an opportunity to start making friends, to start finding other people that have similar interests to yours. In my role, I'm also very, very interested in listening to you and hearing your feedback. And in my opinion, one of the most exciting opportunities when anyone joins university, but especially when you join UCL, is the chance to take a really active role in your course and make your mark by helping improve the program and UCL services in general. And there are many ways in which you can have your voice heard. For example, participating in anonymous surveys or engaging in focus groups. And my personal favorite is through your course academic representatives. So I'm going to tell you a little bit more about this. So each program requires 1 or 2 academic representatives each year who are democratically elected by your classmates. And I would like to encourage you to start thinking about becoming potentially a student rep for your program. And especially if you wanted to develop some leadership skills. The student representative is a volunteer position, which will require a few hours of work a month, meeting with other reps, collecting feedback from your classmates, working with university staff to ensure that your peers' feedback is communicated and acted on. For example, in the past, students in the population health program requested a space to hang out in the department just for undergraduate students, and we made this possible. Now undergraduate students have this space for them in the department. And student reps will receive training. And I tell you this is a great work experience and something really good to put in your CV. So consider this option, right, as part of your UCL experience next year. And when things get overwhelming or something unexpected happens, please know that there is always someone who can help you here, whether it is your course director, your personal tutor, your program administrator, myself, or even the UCL student support and well-being team. UCL is really lucky to have a great team that provides a safe, confidential, and non-judgmental space for you to discuss any issues that impact your life or your studies. Okay? And just finally, I would like to mention that we are putting together an induction week for you, which will take place in the last week of September, and is full of events, some at program level, others at faculty level, at UCL level. There are campus tours, support services, fairs, the UCL 101, how to survive your first term at UCL, etc., etc. So just to encourage you to engage during this week, because it's going to help you also to settle in much better. Thank you, that's all, and I'm looking forward to working with you in the new year, and I'll stay here if you have any questions. Thank you.
Great, thank you, Paloma. That was great. We'll move on to a Q&A, and Paloma's kindly agreed to stay too. So what I'm going to do now is open the floor to you guys to ask questions to our panel here of our current and former students, as well as Paloma and myself as well. So this is really your chance to ask anything you like. And the way in which you can ask the question, I really don't mind. You can drop a question into the chat on Zoom here, or if you feel brave enough, then just turn on your microphone and start speaking, and we'll take questions that way. So this is an opportunity now, like I say, for you guys to ask anything you would like to know about university life, UCL, or the course specifically. So whilst we're waiting for you guys to come up with your questions, I'm gonna start grilling our panel here. So I'll go with Jamie first, given he gave the smile first there. So Jamie, why UCL? What made you originally come to do your undergraduate degree, and has brought you back to do a PhD as well?
I mean, initially it was more of a matter of the course. No other university, I think, has or does offer a similar course focusing on both population health while also giving training with the data science training, essentially. The reason why I came back was completely different, I think. Everywhere offers postgraduate training with epidemiology and health data science, but there's a lot of cross-departmental collaborations that take place within UCL. So there's opportunities to work across different departments with different professors, lecturers, researchers across a wide range of disease areas and topics and methodologies that made it very enticing to come back. And Stephen's not paying me to say this, just to make that clear. It is genuinely a nice place to be, especially within the area of public health, I'd say.
That's very kind, Jamie. Mona, what have you enjoyed most about your time thus far at UCL?
I honestly really enjoyed the course and the individuals that are like participate in the course, whether that was professors or whether that was my friends in the course. I think that everyone was so supportive during my time here. And even as you mentioned, Paloma, my personal tutor, was such a amazing person to be around. And I think that the support that UCL gave you during my time here was honestly such a great experience.
Great, thanks, Mona. And Walter, how about you? What have you enjoyed most about your time here? thus far?
I've enjoyed a bit of both, so the course and the life at UCL in general. So when I first came to university, I had like a mindset that I would be in such a big lecture theatre with loads of different people. But the fact that I took a course was quite good. Got to third years and second years as well. And as a second year student, I get to interact with first year students on the course. And also that we have outside of the course. So the course is of teaching, and it gives the rest of the time to do other things. And I've enjoyed UCL because of the opportunities, like I said. And the one opportunity that stood out to me was being a student ambassador.
Thanks, Walter. We're a little bit of, I don't know if it's just me, but a bit of breakup on your audio there. But
Yeah, I don't think I didn't hear much about.
Great. I don't. Maybe Walter, you could knock off your camera. I don't know if that will make a difference. But I'll come back to you in a moment, because I can see we've got quite a few questions coming in on the chat. So Rosa asks about the balance between exams and coursework. Mona, you're in the sort of final furlong. Do you want to take that on? What's the balance been over the course of the 3 years in terms of exams and coursework?
So I think that our course on a whole, especially on the non-data route, is more coursework based. I think maybe it's like a 70 coursework, 30 exams, which means that coursework could range, it could be presentations, it could be essays, group work, and then final exams. This could be written or, as I said, presentation based or video based nowadays. But yes, so I think that it's 70% coursework and 30% exams. I don't know if you would agree, Jamie, or Borda, but I think that it's a 70-30%.
Yeah, I mean, for the data science pathway, all of the courses are coursework based. There are no exams, just because everything is coding based and it's difficult to really assess you with a written exam in a lecture hall. The only exams that come to mind are, say, epidemiological transition first year that we're prescribing this year, which is a 2-hour essay, and then health economics comes to mind as being exam based.
And I had another one in second year, which was health demographics, which was with Steven.
Yes, Steven's one. Yes. Those are the only 3 that I can think of. Otherwise, everything else is completely coursework based, which is what I prefer.
Yeah.
I mean, I think I would just add that it depends on your module selection. So over the course of your 3 years, you'll have the ability to choose particular modules in your second and third year. And some of those might be assessed through exams, some might be assessed through essay. But I think both of your experiences is pretty common. I think of the modules that people take, probably something like a maybe 70-30, maybe even 20-80 split from what Jamie was saying there. But it's definitely more coursework based. But as Mona said, what constitutes coursework is quite varied. It isn't just writing exams. We have a question from Natasha about study abroad. Did any of you guys consider study abroad?
I actually did consider. I didn't end up doing it, but there are some amazing opportunities to study abroad in Canada. Some students went to Japan, actually, and even in the States, I believe. I'm not too sure. But there are really, really a range of different opportunities to study abroad. And the people I know of who studied abroad really, really enjoyed it. And they came back this year really promoting it. And I think that it's a really great opportunity to do this.
Thanks, Mona. But in response to Natasha's question, yes, there is a study abroad option for our degree program, which you don't need to select before coming and not even on arrival. It'll be something that you'll be able to apply to do during your first year. A question from Melanie, which asks, what have the students enjoyed about living in London? And what have the students found most difficult about living in London? Should we test out your microphone, Warder? what have you enjoyed most about living in London?
Um, so I like the fact that I'm from London, so I live in London anyway. But the fact that I commute to central London, I enjoy it. I enjoy the commute because it's relatively quick with the New Elizabeth line, and I like that there's loads of food options nearby UCL. So sometimes it's a bit of a struggle to choose what to have for lunch. But I like the different food options because there's different cultures and cuisines that you can try. And I also like the green spaces around campus. So we have loads of like squares and parks that I enjoy going to like on my breaks. So yeah.
Right, thanks, Warder. The microphone seems much better now. Warder or Jamie or Mona, has there been any difficult aspect of living in London? Anything you found challenging?
Rent. I think that's the main thing. There aren't any other challenges that come to mind. Student accommodation is accommodating, but if you're looking at the private market, especially in this market right now with this economy, it can be a bit difficult. But I think UCL does give enough support in terms of the accommodation that's provided within the university to make that less of a hassle.
But that's not guaranteed in your second or third year, is it?
I'm personally not sure. I live with family.
Right, okay. Mona, did you ever live in halls or?
Yes, I actually did. In my first year, when you apply to UCL, it was very, very straightforward, and you have to kind of select options of what you're looking for as an accommodation. And they provide you with an accommodation you could choose to accept or to refuse. But I do really recommend you, if you have the opportunity, to live in accommodations because, I mean, this is personal experience, but I've met my closest friends in halls. So it's a great opportunity to meet a lot of people, and there's many events that go on within halls as well. But second to third year, they do not offer place. However, I know that you could apply for one if you really, really are struggling to find a place to live. However, UCL does prioritize first year students.
And there is support, isn't there? There are housing
Yeah.
officers who can help you negotiate the private rented market in terms of how to find, how to.
UCL can act as your guarantor if you're an international student as well. I think there's a threshold for the maximum, but yeah.
Great. I have a question here from Melanie, and I can see there's one from Salma as well. I'm going to take Melanie's first because it sort of feeds into what Salma's asking, which is, have the students had opportunity to participate in internships or work experience, and have these been easy to find? Mona, do you want to kick off on that one? Because I know that you did an internship as part of the program, didn't you?
Yeah, I actually did. So, I did it with a company called Health Lumen, and so the course advertised it. So I kind of applied throughout the course, if that makes sense. And it was actually so, so fun. The people there were amazing, and it was kind of, I don't know if you agree, Jamie, but it's kind of health consultancy
Yeah,
fun.
I mean, like right now, so I'm working at Health Lumen now. And I'm working with Nesta, which is a big charity focused on addressing obesity in the UK. And also I'm doing a project with AstraZeneca right now, focused on chronic kidney disease. So yeah, proper consultancy, basically being outsourced to do some of the external research for these different companies.
Definitely. And I mean, I worked on a project on mental health, and what my usual task during my time in the internship was to look at costs and really look at the healthcare systems on a whole. So it was very much public health / health consultancy based. Yeah.
Right. And any of you guys, what's your sort of take on the ease of which it is to sort of find internships? I mean, yours, Mona, was tied to our program,
Yeah.
but have any sort of sought things outside the program and beyond, and how easy has that been?
I got an offer for one of the Q-Step internships back in the day. Didn't take it because I had another offer from the National Institute for Health Research. So that was with the School of Public Health. That was focused on, what was it? Nutritional labeling. So basically we were running a randomized control trial trying to test the efficacy of nutritional labeling in helping consumers make more informed decisions. And that was based at the Obesity Policy Research Unit. That was, I wouldn't say easy to find, but the
How
positions
did you source it,
external to
Jamie?
UCL. That was
How,
for UCL Careers.
right.
Yeah. So that's the thing. UCL Careers has a daily newsletter that gets sent to you where they will go out of their way to source out opportunities that aren't widely advertised, say on sites like LinkedIn or Indeed. So there's opportunities out there. You just have to apply for them.
Yeah,
Well, I
and
think that, oh, sorry, Mona, go ahead.
yeah, I do also want to mention that applications on a whole for internships in London is extremely challenging, but I don't think that it's because of our course. I think it's on like a daily basis for everyone who's applying to any
Yeah.
internship. I think it's very difficult. I do think that there's a lot of research opportunities at UCL. I mean, I'm currently applying to research opportunities at UCL for this summer, which has been advertised within UCL. But I do want to emphasize that finding an internship is very difficult with like whether you're in this course or whether you're not. Yeah, just London market.
But I'd say if you're looking at stuff within public and population health, this course does make it easier. At least it did for me. I mean, for me, I was told afterwards my internships were competing for one spot from around like 20 applicants, and having this course does make a difference, especially if you go on the data science route. You can really sell those skills that you learn.
Yeah, thanks, guys. But one thing I just wanted to pick up on what Jamie was suggesting there about the UCL Career Service, and it speaks to a general point about coming to a university like UCL because of its sheer size. So, as Paloma was talking about earlier, the diversity of the student societies, but the same applies in terms of career opportunities. Lots of employers come to UCL to advertise their opportunities, whether it be internships or whether it be part-time or full-time, semi or permanent work for graduates. They come to UCL and they ask the UCL Career Service to advertise those because the reach that the UCL Career Service has in terms of current students and alumni is, hundreds of thousands of people. So you will hear about stuff being at UCL, which you might not hear about otherwise, which, like I say, really speaks to UCL's size. I have a question from Annabelle, and Walter, maybe you could pick this one up, which is what skills can be gained from the non-data science route, the main program? So, Walter, what would you say are the sort of main skills that you're sort of taking from the degree program at the moment?
So I'll say from the main program, you learn transferable skills with this like different selection of modules that we take. So we take research methods and other interesting modules, but within the modules you get to interact with students. So I would say teamwork skills during the seminars, as they're quite small, good communication skills, presentation and oral skills through the assessment methods, and active listening in lectures, and just loads of transferable skills, I would say.
Great. Thanks, Walter. So I'm going to pick up Salma's question and then a question also from Rosa, which I think sort of speaks to what the degree sort of potentially could lead to after graduation. And so Salma asks, what's the most popular route after completion of the course? And Rosa talks about whether there's a potential to branch in areas other than health. Maybe if we just sort of go around the room, maybe we sort of know what Jamie's doing now, but maybe Mona, start with you. What are your plans after graduation? What were your questions?
Yeah, so I am most likely, so I got accepted to an MPH at Imperial College London. So it's a Master in Public Health, and I'm doing a graduate program. So yeah, really nice. I also got offers from UCL it was a sustainable policy program, and I had also had an offer from LSE to study international health policy. Yeah.
Congratulations, Mona.
Congratulations, yeah.
It's quite the sort of suite of offers there and opportunities. I'll come in here and just say that what Mona's planning on doing and what Jamie's done, which is to do further study in the first instance in the form of a master's, is probably the most common destination. Not vastly, I would say, probably about 50-60% of the students who graduate from our course go on to do postgraduate study, master's courses at a range of institutions, some in the UK, some overseas. But there are students who don't. There are students who do go straight on into work. And the diversity of what students who have left the course and gone on to do, gone straight into the labour market is really diverse. We have alumni who are now working as teachers in primary schools. There's one in secondary school. We have students who've gone on to work in finance. So
yeah, to follow on from Stephen, one of the people in my cohort, Eunice, she's working at Ernest Young. So yeah, finance is definitely an option there. Someone's at Accenture, I believe. So consulting there as well. So yeah, to answer your point, Rosa, yeah, those opportunities are available. And at the end of the day, when you're applying to those jobs, it really, at the end of the day, does come down to your university. UCL is a target for finance jobs, so you shouldn't have any problems as long as you do a proper preparation in terms of applying for them.
Yeah, thanks, Jim. I mean, and what I'd say about the course is, although it's a course which is focused around health, the skills which Warder was talking about before are as generic as you would get on any other social science course. So I don't think it sort of precludes sort of application to the main the jobs in the graduate labour market, which happen to be in the UK anyway, in finance. But other range of sectors as well, which I think doing this course perhaps is not the natural pathway, but I don't think it sort of stops you sort of moving into those areas should you wish. And should we pick up a question from Natasha? So Natasha asks about the day-to-day timetable and roughly how many people are on the course. So Ward, did you want to pick that up, the first part of that for us? Well, what's your weekly contact hours?
So I think I would say it was about 4 days a week, but 3 hours, mainly between 10 to 1 or 2 to 4, spread across 4 days. So it's about 12 hours of contact hours a week, both in first and second year, and which I find really good because it gives me a day off, and it also gives me the rest of the day to do my uni work and also go to like events in the evening. So I would say it's really flexible and manageable. And the second part of the question was the
number of people on the course. So how many people are in your cohort? Do you know?
30, 35, 30.
Yeah.
There's around 30 people in first year when I was teaching with Nicola. So yeah.
But then as you progress through the course, and if you were like Jamie to do the data science route, then you would be doing modules, compulsory modules with students from a whole range of other programs at UCL, and you'd be in lecture theatres with as many as 150, 200 students for some of those classes. So it sort of depends on what you decide to do, but the core modules as part of the course are generally delivered to the sort of 30, 35 students of our own from our department, and sometimes students from other departments, as well as sometimes students who come from overseas to spend a term or sometimes a year at UCL. Rosa asks a question for students who are looking at private accommodation. What area would you recommend? So Mona, I presume you went into the private rented market after first year?
So in second year, I actually lived quite near UCL. I lived in like near Warren Street area, which is a 10-minute walk from UCL. And then now I live near Camden, which has a bit more affordable prices if you're looking to live near university. But yeah, Camden is a good area. You could try to find areas near UCL, but it gets quite competitive as many students are trying to apply near UCL. Or you could go a bit more like near Angel, Shoreditch. Yeah. Or South London. I get a bit more south, but yeah.
I mean,
Well,
I
I
guess
guess-
for me, yeah.
Okay, Jamie, go ahead.
No, I live out east now. I found my own place now with a PhD. With the Elizabeth line, that makes life a lot easier, I'd say. My commute is only 30 minutes, even though it's quite decently far out. The old commute without the line would probably take an hour and a half. So there's more options there as well.
Great. I'm going to bring the Q&A to a pause. If anyone wants to ask questions, please just continue to drop them on the chat, and we'll either answer them at the end if there's time, or we'll pick them up via email that we can get out to you guys. But for the last sort of 15-20 minutes, I just wanted to go through my taster lecture with you guys. And let me just okay, yeah. Can everyone see that? Can you see a slide which says ethnicity, neighborhoods, and health? Yeah, great. Okay, so this is a snippet from a lecture that I do on our course on a compulsory first year module. So if you guys on the call with us today, if you were able to come to UCL to do population health sciences, this is a lecture which, well, might not happen next year, but probably will. But it's certainly something that our existing students have experienced. So I'm just going to give you a bit of a snippet from it, really. And so broadly what I want to talk about is the relationship between ethnicity and health. But first, I just want to talk about the diversity, the ethnic diversity, particularly here in London. So what you can see on the slide there are some stacked bar charts showing the makeup of the ethnic groups as were measured in the 2021 census for a selection of boroughs in London. So the electoral, the administrative geography in London is separated into what I think is 32 boroughs. So we've got 6 selected boroughs here, selected as though being the most diverse, the most ethnically diverse. So you can see there from Newham at the top that none of the ethnic groups as measured in the 2021 census have more than a fifth of the population. So Newham in East London, incredibly ethnically diverse place. And all of these other London boroughs here, you can see by the variety and the size of the stacks on the chart there, are all incredibly diverse places. But I'm going to ask you guys a question. Those ethnic groups you can see listed on the slide there, so these are the ethnic groups that are used in the census in England and Wales. Which of those ethnic groups do you think has the best health? If you guys want to drop in on a chat. So which of the ethnic groups that you can see listed on the slide there, which ethnic group has the best health? Jamie, what would you pluck for? Which ethnic group do you think has the best health of all of those groups?
Probably white British.
Okay, Jamie's going for white British. Mona, how about you?
I was going to go the same, I think.
Okay, and Wardo, what would you pluck for?
The same.
Okay, so you guys all think the white British group has an advantage in terms of its health. Well, I think the first thing we need to ask ourselves is how could we compare? If I set you guys all on a task of comparing the health of these different ethnic groups, first thing you'd have to decide is, well, what measure of health am I going to use to compare? We could look at lots of things, couldn't we? Let's start with contraction of COVID. So probably the biggest public health event which we've experienced in modern times. And what we have here are cases of COVID in a selection of 157 GP practices. So for those of you not aware of the health system in the UK, GPs are the primary interface of the healthcare system. So if you ever feel unwell, you don't have something as acute that requires accident and emergency care, you would first go along to your general practitioner. what might be called elsewhere your general physician, and you would tell them what's wrong with you, and they would help you best you can and potentially refer you to other services. At the height of the pandemic, GPs were recording or able to record how many of the patients in their area had been diagnosed with COVID, because as you'll be aware, and I'm sure happened in many other countries, there were, the systems for recording this stuff were sort of like no other that had ever happened before. And so these data were pretty well recorded. We knew the people who were being diagnosed with COVID who attended a test center to get that diagnosis. And so what we can see here on the slide is we've got the patients who had or didn't have a COVID-19 diagnosis by some quite broad ethnic groups, as are measured in the data that is recorded for these GP practices. And the final column there, the column that says the univariate odds, what that's telling you is how more or potentially less likely each of the ethnic groups are to have reported a COVID-19 diagnosis relative to the white British group. And so the fact that all of these odds ratios for these three ethnic groups, South Asian, Black, and other, are greater than 1, are saying that for the South Asian, for the Black, and the other group, they were more likely to have had a positive COVID-19 test compared with the white British group. But what we can see there is there are about 20% of the patients across these GP practices that we don't have ethnicity data for, either when that information has been collected, the patient has not provided it, or for some other reason, the data is missing. This is a real problem with looking at ethnic group differences, at least in England and Wales, is the data that we have is not great. The data that we have from health service data, whether that be through GP records or whether it be through interactions with other healthcare services like hospitals, the recording of ethnicity is not complete. So as we just saw on the previous slide, for GPs, they're about 20%, and that's not specific to London. Outside of London and the rest of England, roughly, I mean, there's some GP practices that do a much better job of recording the ethnicity of a higher proportion of their parents, but generally it's about 80% coverage. Now, for interactions with other forms of healthcare services like accident and emergency or other sort of hospital outpatients, the recording of ethnicity is even worse. And that's something we'd expect. I mean, if you attend A&E, you've just been run over perhaps, and you've been brought into the hospital in an ambulance, the first thing that the clinicians are going to be worried about is not getting a record of your ethnicity. They're clearly going to be trying to help resolve the acute problem that you have. So with those kind of interactions with health services, the recording of the ethnicity of the patient tends to be poorer. So we don't have great data on ethnicity in terms of interaction with health services. But returning to the impact of the pandemic, one data set which was really useful in terms of looking at the risk of death due to COVID was linking mortality due to COVID to census records. So in the UK, every 10 years, we have a census of population. And so everyone in the population is meant to respond to, everyone who's currently living in England and Wales is expected to respond to that. And the census asks questions around ethnicity. We already saw that on the previous slide. And so what we see here is standardized by age, because we know mortality, whether due to COVID or anything else, is very strongly related to age. So here what we have is mortality rates standardized for age for each ethnic group. And in this case, mortality due to COVID. And so responding to what Jamie, Mona and Warder were saying previously, yeah, it looks as though the white group on this measure anyway, due to mortality due to COVID, has better health compared with many of the ethnic minority groups. So in particular here, we can see the Indian and to a greater extent the Black and the Bangladeshi Pakistani group, particularly for men, had much higher rates of mortality due to COVID in the early stage of the pandemic. And this continued through the various waves of COVID that we've experienced since. But why? Why have ethnic minorities experienced poorer outcomes in relation to COVID? And is there something in the disposition of ethnic minorities that make them more likely to contract the virus and then ultimately experience poor outcomes? Well, I don't think directly. I think probably one of the most important underlying causes of these ethnic group differences is due to racism. And racism that's manifested through what we like to call in academic sciences as intersectionality. So racism has permeated through our society and has brought about an inequality of access to employment, inequality in terms of, to some extent, access to education. And that has manifested in a way that during the COVID-19 pandemic made certain ethnic minority groups much more likely to be exposed to the virus and therefore more likely to have a bad outcome. So looking at this previous slide, people in the South Asian groups and the Black groups were much more likely to be still out in the community working, whether as healthcare professionals, as bus drivers, or many other occupations, which were giving them much greater exposure to the virus comparatively to many people in the white group who, I'm not saying this was the case for everyone in the white group, comparative to many people in ethnic minorities, were to some extent fortunate to be able to protect themselves from the virus by staying at home as the government mandated at the time. But that's just COVID, and we should look much broadly at health. And if we look at data from the census, which is limited, the health measures from the census in England and Wales is very limited. There aren't many health measures that we can take from the census, but there is one which asks everyone who completes the census whether they have a long-term illness. And that's something which the census specifies as an illness that's expected to last for a further 12 months. And the question about this illness is followed up by asking, is this illness limiting your daily activities in any way? And so we have a measure from the census of something called limiting long-term illness. And contrary to what Jamie, Mona and Warder were saying, if we look at this measure of population health, there are certainly ethnic disparities. I mean, particularly for the white gypsy Irish traveller group, we can see have much worse health relative to the white British group. Pakistani women and Bangladeshi women too. Interesting, different findings from what we saw on the COVID analysis previously. But many of the ethnic groups, particularly highlighting there at the bottom, the Chinese group, much better health relative to the white British group. So it's not the case that the white British group sort of sits above all of the other ethnic minority groups in terms of key measures of population health. If we look here, this is data from something called the Health Survey for England. This is an annual data collection that takes place, actually run by academics in our department, in the Institute of Epidemiology and Healthcare, which Paloma was talking about earlier on. And what we have here are essentially differences compared to the white British group of having toothache. Now you might think, toothache, that's quite a specific measure of health. Well, interestingly, outcomes in relation to people's teeth, whether it's loss of teeth, whether it's decay of teeth, or in this case, simply the pain in your teeth, the determinants of that are very common to pretty much any other measure of population health which you would want to compare different ethnic groups. As we've done previously, looking at mortality or looking at a measure like limiting long-term illness, the determinants of measures of dental health are actually very similar. And what we see here is that there are some groups, particularly the Black Caribbean group, to some extent the Irish group, the Pakistani group, much more likely to have toothache relative to the white British group. But again, it's not universal that the white British group sits above the others. You can see there that for the Bangladeshi group and the Chinese group, the fact that those numbers there that are referred to as OR, odds ratios, are below 1 is indicating that actually they have slightly better health relative to the white British group. So we have a lot of problems with looking at ethnicity and health in England and Wales, in that I didn't speak about this, but to measure mortality by ethnic group is really challenging, because the way in which we analyze mortality data in the UK is through registration systems, which are fantastic, almost universal coverage, but provide no indication of the ethnicity of the deceased person. So the only way to look at mortality, as we saw earlier on in the ONS analysis, was by linking it to other data, in that case, the census. In the case of health service data, whether it be from general practitioner records or whether it be from hospital records, again, problematic because of the completeness of the recording of ethnicity. And then we have health surveys. We just looked at that data previously about the percentage of people with toothache. Well, they're great, more up to date than the census, includes key measures of health, but these social surveys only tend to include maybe thousands of people each year, and so often don't really tend to give us a very good picture of the very specific differences of specific ethnic groups. So problematic for that purpose. Okay, I'm going to bring the presentation to a close there, because we've only got 5 more minutes before we're going to close. But let me just knock off that screen share there. And then what I'm going to ask you guys is whether you guys have got any final questions that you would like to ask of us. You might want to pick up on something I said during the presentation there, or you might want to ask any other questions.
I think Annabelle had a question.
She does, yeah. It's a really great one, isn't it, Jamie? So
Yeah.
let me just read it out, and then I'll pose it to you guys. So Annabelle asks, as someone who doesn't study A-level maths, would the data science route be harder than the alternative? Jamie, as the only person who's been through the data science route on the call, do you want to take that? And maybe, if you don't mind, can you tell us whether you did or didn't do maths as an A-level?
I didn't do A-levels. I did an A-level equivalent to the International Baccalaureate, but yes, I did take maths, but at the standard level. So more, it's like halfway between an A-level and GCSE. I feel like I say this every year to prospective students, but maths was my worst subject in high school. And yet here I am basically doing a PhD in statistics. So the data science pathway really does start from scratch. And I mean, even teaching on it now, I try to keep it that way. All of the lecturers know that students don't necessarily come from a mathematics background. Because the pathway is studied between population health students, geography students, social science students, and PP students. And you can imagine PPE students wouldn't necessarily have a maths background to come in and study the data science pathway. So very much, you can do it. I was able to do it. It was challenging, but here I am teaching it again. And I do try and make sure that when I am conveying more difficult concepts, that, you know, I sketch everything out, I draw things out, I specifically point to, you know, statistical output to make sure that everything is as clear as possible. And I think, or I found that my students appreciate that. So hopefully, if you do come and do this degree, that will be your experience as well. IBSL maths.
Well,
yes,
I'll just pick up on what you said there, Jamie, but I think Jamie's right. The data science route is very much taught from first principles. So if you haven't studied maths at high level through IB or A level through the sort of standard system in the UK, that's not a problem. I won't lie and say that A level maths is probably going to give you, I don't think in terms of the content, but I think perhaps will give you somewhat of an advantage in terms of what to expect, but it's not required. And what I'll also say about your choice of route is it's not something that you need to definitively decide prior to arriving. So I think it'll be good if you have thought about which route you want to do, so that when you come, that you can pick that and we can get you all on the modules that are required for that route, but it's not essential. In the first couple of weeks after your arrival, we'll go through, explain in a lot more detail than we've had a chance to do today, explain what's involved in the two different routes. And if you've picked one, but actually think you'd prefer to do the other, in those first 2 weeks of term, it'll be fairly simple on your part process to switch between the routes. And then as you progress through your study, there is also the option to change as well. It's a bit problematic to change to data science after having not started it. But if you choose data science and wish to change onto the main program after your first year or second year, then that is, again, quite a simple thing for us to switch you on.
Yeah, and to respond to Rose's question, so will IB standard level maths still be manageable? I know the curriculum's changed, so I'm not as familiar with how everything's changed now because there's two types of maths. But I think if anything, what we had in math studies, what the equivalent is now, more of the statistics-based program is actually more useful than SL, because we focus more on calculus to some extent, which can come up in terms of rates, but isn't something that necessarily is necessary. I wouldn't worry about any of the prerequisite maths content that you necessarily need or want. We'll teach you on the course.
Yeah, thanks, Jamie. I completely endorse that too. I just have one final question from Melanie, which I'll respond to, which is Melanie asks about whether there are office hours with teaching staff. And yes, so just to make clear what office hours are, so generally the way that the teaching will take place is you'll have a lecture each week, and that will be followed by a seminar. If you're in a large module, then the lecture might take place with all 150 students in the class, and then the seminars would typically be in smaller groups, maybe 20 or so. And then outside of class, there will be the opportunity for you to meet with the teaching staff each week. It's not a mandatory thing. It's something that you can choose to do. But certainly for my modules, I have at least an hour or two each week where students can book on and come to see me either in person or online like this. So there's definitely that option. And that's the case on all modules, Melanie. The way which people facilitate it sort of varies a little bit from module to module, but what's generally referred to as office hour is available weekly during term time. Brilliant. Well, we're past the hour now, so I'm going to bring things to a close. But thank you so much for everyone attending today. I hope you've found that useful and it will help in your decision making in terms of whether to accept your offer. If you don't have any other questions that you want to ask us after today, then by all means contact us. I'm sure you've all sort of caught wind of our generic email address, which is BSc Population Health at UCL. So if you've got any follow-up questions that you'd like to sort of pick our brains on, then drop us a line on that email. But otherwise, I'll hopefully look forward to seeing you all in late September, early October. But before we finally finish, if I could just give a big thanks to Paloma, to Warda, Mona, and Jamie for sharing their insights today, which I suspect you found much more useful than hearing from me. So thank you, everybody, and good luck with your final high school exams.
Thank you. Oh, so I just want to quickly add, I'm on UniBuddy. If you guys have any more questions, you could just message me on the app. Yeah.
Thank you, Mona.
Yeah.
Great.
No worries. Thank
Great.
you.
Brilliant. Thanks, guys. Bye-bye.
Thank
Thank
you,
you.
everyone.
Bye-bye.